Do you suffer from low sex drive? Well, what can you do about it? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about the pharmacologic treatment options for low sex drive. Now, low sex drive is pretty common. It's seen anywhere from 5 to 17% of men, and it's probably less reported than it actually exists because a lot of men don't come see their doctor. Now, remember, low sex drive is when you have a persistent absence of sexual desires or fantasies that causes you bother or distress that then affects your quality of life. So when we're treating low sexual desire, it's important to get evaluated first to make sure there's no other underlying conditions that could be causing your low sex drive, like low testosterone, elevated prolactin, abnormalities in your thyroid hormone, so on and so forth. Because the first line of treatment is then focusing on fixing that problem that will then reassess your sex drive to see if that's improved your libido. But what if everything is normal and you have what we call primary reduced libido? We're going to talk about 4 different things that you can try. First is bupropion. Now remember, all of these things are generally off-label. There has been some study in women, but even much less in men. So bupropion is actually an FDA-approved antidepressant medication, and it's also used generally to treat depression and seasonal affective disorder, and has also been used to help with quitting smoking. How does it work? Well, it's not exactly clear. The thought is that it prevents the reuptake of neurotransmitters called norepinephrine and dopamine. In a small study looking at people taking 12-week trial of bupropion, they found that those who got bupropion versus a placebo were significantly more likely to see improvements in libido and sexual function, with about 63% of people taking the medication seeing an improvement compared to only 3% in the placebo group. And the improvement, because this was both men and women, was actually more prominent in the male cohort, with 86% of men showing improvement compared to only 44% of women. And generally, it was pretty well tolerated, with side effects including weight loss, nausea, agitation, and insomnia, but nothing major that people reported having to stop the medication for. And in more recent studies, they're actually looking at a combination of bupropion and trazodone, looking for female hypoactive sexual desire disorder, and that is actually showing better results compared to bupropion alone, but there's no data in men yet. Number 2 is Flibanserin, also known as brand name Addy. Now, this is an FDA-approved medication for women, premenopausal women with hypoactive sexual desire disorder. It was approved in 2015, and I've made a full video about it, calling it the pink pill instead of the blue pill. And how it works is it stimulates some serotonin receptors and then inhibits other receptors. So basically, it works on serotonin receptors in the brain, and through both activation and inhibition of these receptors, it's subsequently increasing the release of, again, the hormone dopamine and the neurotransmitter norepinephrine, which are both really important in promoting sexual excitation. In addition to that, it also reduces the level of serotonin, which actually works by decreasing sexual desire. So why people who are on SSRIs for antidepressants do notice a decrease in desire sometimes. Now, there is very little data for this on men, but it can be used. It's essentially taken once a day at nighttime before bed because it can cause fatigue. And if you want to learn more about it, make sure you check out that video. But generally, risks are having a low blood pressure and having syncope or fainting. And then you certainly want to watch certain medications that you're taking can interact with it. Number 3 is Bremelanotide. Now, a lot of people are taking some off-label version of this, PT141, whatever, but Bremelanotide is actually FDA approved, again, for women who are premenopausal with hypoactive sexual desire disorder. Now, how this works is it is an analog of a neuropeptide called the alpha melanocyte stimulating hormone. And this acts on multiple melanocortin receptors that then are involved in kind of the excitatory pathways for sexual desire and arousal. And there has been more data on this. In fact, I made an entire video on Bremelanotide for men, and it's been shown to increase both erectile function and desire in men by, again, stimulating these melanocortin receptors in the brain, particularly in the hypothalamus. Now, how this works is you take an injection that you give yourself about 45 minutes before you want. And it can cause some nausea, which is actually quite frequent, particularly in the first dose. So sometimes you can take an anti-nausea medication at the time of taking the medication. It can also cause some facial flushing and headache. And in rare circumstances, it can cause some changes in coloration under the armpits or on the breast tissue near the areolas. That's if you're taking it more than 8 times a month is more common. Now, lastly, DHEA. So DHEA has a lot of fanfare. And basically what it is, it's a precursor to estrogen and testosterone. It's naturally occurring in the body, and it has effects in both the brain as well as in the periphery. And in the brain, it acts like a neurosteroid. So you will see if you look up DHEA, people say there's many other benefits for brain health as well as sexual function. Now again, the studies here are limited. DHEA has not shown a significant benefit in libido, particularly in men who have normal levels of testosterone. And this is because it probably exerts its effect primarily by converting into testosterone and increasing testosterone itself. Now, if you remember from my video on low libido a couple weeks ago, that at a certain point, having more testosterone doesn't really impact you very much because of the saturation effect. So the way DHEA is theorized to work is because it increases testosterone and estrogen. So if you have normal testosterone levels, it's unlikely to improve your libido. And generally, when you look at the data, it has shown mixed results. In postmenopausal women at about 100 milligrams a day, it has shown a benefit in arousal. However, they did not see the same benefit in male population in that same study. And really important to remember, there is no FDA approved formulation for DHEA. And in studies that have looked at DHEA concentrations in over-the-counter supplements or supplements you can buy online have shown that DHEA levels can be none or, 40% of what's on the box or more than what's on the box. So it's important to realize that when you're taking these supplements, it may not be effective because it's not effective, or 2, because you're not getting the right dose or you're getting too much. There is a formulation of DHEA that's vaginal that is FDA approved called prosterone or intrarosa that has been shown to be very effective for women with genitourinary syndrome of menopause. Now, side effects of the DHEA that have most commonly reported are nausea and acne. So I hope you guys found this helpful. If you want a more in-depth video on DHEA, please comment below. If you enjoyed this video, make sure to check out my video on how you can boost your testosterone with exercise and what specific exercises can help you boost your testosterone. As always, remember to take care of yourself because you're worth it.